Disclaimer: I have no medical training. This is for informational purposes only. Do not use this as medical advice. See a professional if you need to. I am not an expert in this topic, just trying to learn from GPT. Welcome to CognitionChunks. This is Beginner Guide to Understanding Your Health. Asking: how can a comprehensive metabolic panel be used to accurately gauge a person's health? A comprehensive metabolic panel, CMP, is a blood test that provides an overview of your body's chemical balance and metabolism. It can give your healthcare provider important information about the current status of your kidney function, liver function, and electrolyte and acid/base balance, among other things. The CMP is often used as a broad screening tool to evaluate organ function and to check for conditions such as diabetes, liver disease, and kidney disease. Here is a detailed overview. Components of a comprehensive metabolic panel, CMP. 1. Glucose. Normal range, 70 to 100 mg/dl, fasting. What it reveals: blood sugar levels. High levels may indicate diabetes or other glucose metabolism issues, while low levels could point to hypoglycemia or other conditions. 2. Calcium. Normal range, 8.6 to 10.3 mg/dl. What it reveals: bone health, as well as the function of heart, nerves, and muscles. Abnormal levels can indicate a range of conditions from kidney disease to bone disorders. 3. Albumin. Normal range, 3.5 to 5 g/dl. What it reveals: liver and kidney function. Lower levels might indicate liver disease or malnutrition, while higher levels are relatively rare but could indicate dehydration. 4. Total protein. Normal range, 6.3 to 7.9 g/dl. What it reveals: overall health, liver function, and nutritional status. Low levels may point to liver or kidney disease or malnutrition. 5. Sodium. Normal range, 135 to 145 milliequivalent/L. What it reveals: electrolyte balance, important for nerve and muscle function. Abnormal levels could be indicative of dehydration, kidney disease, or hormonal imbalances. 6. Potassium. Normal range, 3.5 to 5 milliequivalent/L. What it reveals: nerve and muscle cell functioning, particularly in the heart. Abnormal levels can be life-threatening and indicate kidney issues or endocrine disorders. 7. Chloride. Normal range, 98 to 107 milliequivalent/L. What it reveals: balance of acidity and alkalinity in the body. Abnormal levels may indicate lung or kidney disorders. 8. Carbon dioxide, CO2, bicarbonate. Normal range, 23 to 30 milliequivalent/L. What it reveals: acid-base balance and respiratory function. Abnormal levels may suggest kidney or respiratory disease. 9. Blood urea nitrogen, BUN. Normal range, 7 to 20 mg/dl. What it reveals: kidney function. Higher levels may indicate kidney disease or conditions that decrease blood flow to the kidneys. 10. Creatinine. Normal range, men, 0.9 to 1.3 mg/dl, women, 0.6 to 1.1 mg/dl. What it reveals: kidney function. Elevated levels can be a sign of kidney dysfunction. 11. Alanine aminotransferase, ALT. Normal range, 10 to 40 units/L. What it reveals: liver function, elevated levels can indicate liver disease or damage. 12-aspartate aminotransferase, AST. Normal range, 10 to 30 units/L. What it reveals: liver function, elevated levels may indicate liver or heart issues. 13-alkaline phosphatase, ALP. Normal range, 30 to 120 units/L. What it reveals: liver and bone health, elevated levels can suggest liver disease or bone disorders. 14 bilirubin. Normal range, 0.2 to 1.2 mg/dl. What it reveals: liver function, elevated levels may suggest liver dysfunction or anemia. How the CMP gauges health. The CMP offers a snapshot of the metabolic and functional status of your liver, kidneys, and electrolyte balance, and it also provides information about your blood sugar and protein levels. While the CMP can provide a lot of information, it is not definitive. Abnormal results often require further testing and evaluation to understand the underlying issue. It's also important to remember that normal ranges can slightly vary between laboratories due to differences in equipment, techniques, and populations served. Alternative perspectives. Holistic health. While CMP provides a comprehensive overview, it doesn't capture everything about your health. Lifestyle factors like diet, exercise, and mental health are also critical. Interconnected systems. The CMP provides a segmented view, which means each metric is looked at somewhat independently. However, many bodily functions are interrelated, and a change in one can influence others. For instance, liver dysfunction can affect protein levels, which in turn can affect fluid balance and kidney function. Understanding the comprehensive metabolic panel allows clinicians and patients to make more informed decisions about health and disease management, offering a multifaceted view of the body's general condition. Was this accurate? I am not an expert in this topic. Did GPT just make up a bunch of stuff that does not exist or does not make sense? Find out next time in the CognitionChunks follow-up. This has been CognitionChunks. Today, we've explored the intricate world of the Comprehensive Metabolic Panel or CMP. Now, let's do a quick wrap-up to consolidate what we've learned. A CMP is like a health report card for your body, giving insights into the well-being of crucial organs like your kidneys and liver, as well as your blood sugar levels, and so much more. For starters, the CMP checks your glucose levels to screen for issues like diabetes. It also measures calcium and albumin levels, which tell us about bone health and liver function, respectively. Electrolytes aren't just something you replenish with a sports drink. Sodium, potassium, and chloride are crucial for your nerve and muscle functions. Imbalances here could indicate dehydration or even something more serious like kidney disease. Speaking of kidneys, metrics like blood urea nitrogen and creatinine provide crucial insights into how well these organs are performing. Then we have markers like ALT, AST, and bilirubin that inform us about your liver health. We also explore your body's acid-base balance by looking at bicarbonate and carbon dioxide levels. These are essential for ensuring that your cells are functioning properly. While the CMP offers a broad look at your metabolic and organ health, it's important to remember that this isn't the complete picture. CMP tests are often part of a broader medical evaluation that takes into account various other factors, including lifestyle, other medical tests, and patient history. So, the next time your healthcare provider suggests a CMP, you'll be in the know. And remember, if anything shows up as outside of the normal range, it's not necessarily a reason to panic. Instead, view it as a cue for further investigation and a detailed discussion with your healthcare provider. If you found this wrap-up useful, don't forget to like, share, and subscribe for more engaging and informative content. Until next time, stay curious and stay healthy.